everyone, welcome to this mini lecture on personality assessment. We'll be looking at assessment in two parts today. The first part will address the different types of tests that might be used to measure personality and the different types of data that are generated by these tests. So that information will be in part one of the mini lecture. The second part will consider test construction. So how do we actually construct personality tests? But also, what are the ethical issues related to the overall assessment of personality? So let's get started with part one. We've already talked quite a bit about personality traits and how people can differ on a range of traits. For example, I might be more optimistic than you, or you might be more of a risk taker than I am. But in order to know how different we are on these traits, we need, of course, to be able to measure them. So traits need to be measurable in order to be useful. But the question is, can we actually measure personality traits? And if so, how do we do it? Tests of personality are ubiquitous. They're freely available on the internet. If you punch the search terms personality test into any search engine, you're likely to retrieve millions of results. I returned over 11 million results when I put personality test into Google. The types of tests available range from well-validated scales to pop culture types of quizzes. You might have done some of these yourselves. So, what Harry Potter character does your personality match? Which character from Orange is the New Black would you be? So apparently I'm Severus Snape from Harry Potter and Alex Voss from Orange is the New Black. So read into that what you will. Some personality tests, as I said, are well constructed and they're reliable and valid measures, while others, while they're fun to do, like the TV show ones and the movie ones, are neither accurate nor valid typically. But how do we tell the difference? So firstly, you can use the knowledge you gained in the mini lectures on research in personality. The concepts of reliability and validity and generalisability are important in personality test construction. But in order to make a judgment about whether a test is robust or shonky, we need to know something about what personality tests are designed to measure and how they are constructed. So that's exactly what this mini lecture will explore. First of all, we'll look at what sort of data do personality tests produce. And secondly, we'll look at the two main types of personality tests, and they're projective tests and objective tests. Okay, so remember the different types of data that are used in personality research? The two main types of data provided using personality tests are B data and S data. So remember that B data is behavioural data. Someone directly observes you doing something and rates this behaviour. Behavioural data can take the form of spoken words, so how you might respond to an ambiguous stimuli. It might be actions performed, so it might be someone filling out a checklist rating how a child, for example, behaves in a classroom. Or it might be through physiological responses, hooking you up to a heart rate monitor or a machine to test your skin conductance in response to distressing stimuli. It might be testing your reaction time on a test to see what your implicit reactions or implicit motivations might be. S data, on the other hand, is regarded as self-judgment data. So where it's not someone else rating you, you're actually rating yourself. The most common form of this type of data is self-report scales. So you note down your own thoughts, feelings, motives, goals, intentions, etc. So you're making a judgment about yourself. It's not someone else judging you, if you like. These different types of data are derived from different types of tests. The two types of tests that we will examine today generate S and B data. So specifically, projective tests generate B data and objective tests generate S data. Okay, so we're going to look first at Projective tests. Projective tests are those that present a person with an ambiguous stimulus and ask him or her to describe what they see. They're called projective tests because they allow the individual to project their own inner needs, feelings, experiences, interpretations, or motivations onto the test stimulus. The theory behind them is that the answers reveal inner psychological needs or feelings or experiences or other hidden aspects of the mind that aren't necessarily accessible to the person. Typical projective tests that we're probably familiar with are ones like the Rorschach Inkblot test or the thematic apperception test, and we'll talk about each of those individually in a minute. But there are other sorts of projective tests that allow you to analyse personality from different documents that a person might produce. So, for example, the content of stories or letters or speeches or diaries or even Facebook pages. So it's not just interpreting the direct verbal responses of the client. This interpretation can be done from a distance, if you like, by looking at personal documents of the person. Projective tests are typically used in a clinical setting by clinical psychologists. And these tests, as I said before, provide B data. So it's not the person providing their own self-judgment, but someone else interpreting a person's responses. Okay, so let's have a look at one type of projective test. And this is the Rorschach Inkblot test. So this is probably the most well-known of the projective tests. It was developed by a Swiss psychiatrist, Hermann Rorschach, in the 1920s. What happens with this test is that the client is shown a series of inkblots. So typically it might be 10 cards, sometimes with blots in more than one colour. So it's not just black and white. And the client is asked to describe what they see. The therapist would then attend to any themes or preoccupations that might emerge from the description. The client is free to use any area of the inkblot, and they're usually allowed to give several responses to each card. So, for example, if you look at this inkblot shown on the screen here, the client might report that the overall image depicts some sort of demonic man wearing a black cow mask. Or they might focus just on the image at the top of the blot and see a dog and a cat facing each other while an eagle stands watch on a branch in between them. Alternatively, the client might focus on the negative of the image, so the white parts. So they might see these white parts at the bottom as a rabbit ripping off a horse's leg. So what the client focuses on and the type of language they use is thought to provide clues to morbid preoccupations or conflicts, for example. So unusual descriptions or recurring themes are of particular interest, especially if they're consistent with other information that might have been disclosed in a therapy session. There are several scoring systems that have been developed over the years to increase the reliability and validity of this type of test, but most psychologists probably rely on their own insights and intuitions in interpreting answers. Another type of projective test is called the TAT, or the thematic apperception test, and it was developed by Henry Murray. Here the client's shown a series of ambiguous images and they're asked to describe the scene. So they might be asked to say, who are the people in the picture? What are they doing right now? What were they doing before this exact moment? And what will happen next? Most of the images contain people, but the facial expressions and the nature of the interactions are typically vague. And this allows the person to project their own interpretation on the scene. It's thought that these tests can measure a person's motivational state. For example, if you think these two people are fighting, then this might indicate some latent aggression. If you think they're in love, then this might reflect a need for intimacy. If you think one is ordering the other one around, then this might reflect a need for power. So again, the person is projecting their own interpretation onto an image. Similar to the Rorschach, a relatively objective scoring system has actually been developed for the TAT, although many therapists would rely on their previous experience and their own insights to interpret the answers. Okay, so if we think about projective tests and think about the potential advantages of these, typically they're used quite extensively in clinical settings. So the Rorschach, for example, is clinical psychology's fourth most used test, and many clinicians actually swear by their utility. One advantage is that it's considered good for breaking the ice. Another advantage is that skilled clinicians are actually able to use them to get information that's not captured in other types of tests. So it's a way of getting some insight into a client's motivations or insight into processes that might be beyond the client at a particular time or outside of their awareness. Projective tests are not without their criticisms, however. As you can probably guess, the main concern is around validity. So what are these tests actually measuring, and can we predict anything from the results of these tests? Some critics would argue that they're actually not measuring anything, and they should be regarded not as tests, but a type of structured clinical interview, if you like. The most valid tests seem to be the TAT and the Rorschach, using more reliable scoring or standardised scoring measures. Another disadvantage is the expense and time it takes to conduct and score these tests. So, for example, a Rorschach takes around 45 minutes to administer and around 1.5 hours to score. Another disadvantage is that a psychologist cannot be sure exactly what a projective test means. So answers might be interpreted very differently. So two different scorers might come up with two completely different interpretations of one person's response. So there's not a lot of real clarity around what the responses actually mean. The other point that critics make is that other less expensive tests work just as well or better than projective tests. And typically these tests are objective personality measures, and they're the types of measures that we'll have a look at now. So an objective test of personality is different to a projective test in that the person being tested is scored based on a set criteria. The responses to the questions of the person being tested are not interpreted or judged in any way by the assessor as they would be in a projective test. So the definition of an objective personality test is a test that consists of a list of questions to be answered by the subject, and usually in a pretty standard way, like yes or no, true or false, or on a numerical scale from not at all like me to very much like me. The test is then scored in a standardised way. So if you answer no, you get a 1. If you answer yes, you get a 2. The questions in these types of tests seem more objective and less open to interpretation than projective tests. So they seem to be tapping more directly into the construct that we're interested in. So this here is an example of an objective test. So these are items typically found on a test of the Big 5 personality traits. As you can see, the questions seem to be more directly related to the construct we're interested in measuring, and the face validity is relatively high. We seem to be able to tell from looking at the question what the question is actually trying to tap into. So for example, the first item, I feel like I'm on an emotional roller coaster, is an item that's clearly aiming to tap into a person's emotional stability, or in Big 5 terms, into neuroticism. You can see that this is a more direct way of assessing emotional stability compared to a projective test where emotional instability might be inferred indirectly through a person's response to an image in an ink blot. So objective tests are interesting in that they can be constructed in a number of different ways. As a result, some so-called objective tests don't appear to be very objective at all, and that's what we're going to have a look at in the next mini lecture. So part 2 of personality assessment, we'll look at objective tests, how they're constructed, and whether they can be regarded as objective at all. So stay tuned for that discussion in the next mini lecture. So just to recap, what we've covered in the current mini lecture is the types of data that are provided by personality tests, that projective tests typically generate B data, and that objective tests generate S data. We also address the nature of projective tests, their perceived disadvantages and advantages, and how they differ to objective tests. So that's it for this mini lecture. Thanks for listening, and don't forget to watch part 2 of personality assessment, where I talk more about objective personality measures. Thanks.